Welcome to the Power of One. November is Epilepsy Awareness Month. Today, I will be speaking with Dr. Poukas, who is an epilepsy specialist. She will shed a little bit of light on epilepsy and what people should do if they are epileptic to stay healthy and possibly seizure-free. Welcome to the show, Dr. Poukas. Dr. Poukas, what is epilepsy? Why does it occur? And are there different forms of epilepsy? And can you explain those different forms?
Good evening, Melody. So epilepsy is a very broad condition. So in a science way of describing it, it's a imbalance between a bit too much in excitation in the brain versus not enough inhibition, and then seizures happen. So epilepsy is a condition in which brain is capable of producing seizures without a provoking factor. So, for example, somebody who may take a medication that can bring on a seizure, or maybe withdraw from a substances and that can bring on a seizure. Those two examples, those patients don't have epilepsy; they just simply have provoked seizures. Someone who has epilepsy when seizures just occur for no particular reason.
I know there are different types of seizures.
Yes.
My middle brother, Eric, has been epileptic since the age of 7. So when he was young and we would get ready to eat, my mom and dad would notice he would drop his head, and it happened in the evening. So is that one type of seizure? I know that is one type of seizure.
Mm-hmm.
And then when he was, I want to say 18, he had grand mal seizures.
Mm-hmm. Mm-hmm.
And then later on in life, he actually had, and I don't know whether this is the proper name, drop seizures, where he could just be standing up and that was it. Like he's broken his nose before, he's broken his ribs. The grand mal seizures that my brother Eric would have, they would always come in the morning, early in the morning, between the hours of like anywhere from like 7 to probably 7:30 a.m. So explain to me the different types of seizures someone can have.
Right, absolutely. I mean, it sounds like your brother has had a very complex type of epilepsy. Um, so seizures are generally kind of subdivided in two main categories. So there is a seizure which is a generalized onset, and I'll explain, versus a seizure that is a focal in onset. So a seizure that is a focal onset, I think it's a little easier to kind of understand, is when you have a seizure that starts in one part of the brain and that will spread throughout the brain, and depending on where it starts and how it spreads, it will present in it will present with different manifestations that we call semiology. Now, there's a generalized type of epilepsies when those types of epilepsies tend to be genetic, meaning a person is born with predisposition of having that type of epilepsy, and that's when a seizure kind of starts. Involves the entire brain immediately. So those are those two major categories, and obviously depending on where seizure starts, how it propagates or spreads, you will have different seizure types. You can have a seizure type where you have no loss of awareness. So for example, you may have a sensation where you may be dizzy, or maybe you smell something like burning, or maybe have like a sense of deja vu. So there's obviously no loss of awareness. You're sitting and you're saying like, I smell something, but nobody else can smell that. So that's already a seizure. We call that seizure aura. Now, as seizure spreads, if it in fact spreads, then more brain is involved, and then you end up with loss of awareness. So a person may just sit there, may look straight at you, look quite awake, and maybe even looks like making memories. But if you were to talk to your brother Eric, right, would have no recollection of what you're talking about, and may not even answer questions, or may answer questions but make no sense whatsoever. Might just say yeah, yeah, yeah. And then again, when the seizure spreads, a person person may become generalized. So this is, and then again, depending on where in the brain seizure starts, you will have different seizure manifestations. So if it starts in the area that controls your thumb, you may have a thumb twitching. If it starts in the area that's responsible for maybe heart rhythm, you may feel like dizzy, or you may feel like your heart is racing. So many things can mimic seizures, and many things that people think are not seizures are in fact seizures. So I think it's very important to have a low threshold, meaning high suspicion that somebody may be at risk of having seizures. Otherwise, you may miss it. You may only you may ask a patient, are you having any seizures? And they may only count grand mal or the big seizures as seizures and say, no, I haven't had any in quite a while. All meanwhile having little seizures with loss of either awareness or just funny smells. I have quite a few patients like that. So it's very important to realize what's a seizure and then ask questions when you see a patient. Yeah.
So when someone is actually diagnosed as being epileptic, can they continue to see their primary doctor, or should they seek a specialist in epilepsy?
Right. I mean, I think where we live, look, we live in the northeast of the United States. I think we're quite lucky. We live in a large city. So we're lucky to have many neurologists. And then on top of that, you have people like myself who subspecialize further specific in epilepsy. I think that's not the case around the country. So I think if it's a simple, so somebody, let's say, had 2 seizures, and then now you decide, okay, you had 2 seizures, they were not provoked, it's time for you to start on a medication. And if you don't have an access to a neurologist, yeah, I think a primary care doctor should start a medication. And there needs to be some sort of workup to make sure that, your seizures, and this is not a manifestation of something else, like a brain tumor, for example, right? But again, I think we're lucky. So a person may see just a general neurologist, or if epilepsy becomes very complex or complicated, like for example, your brother, I assume, so probably someone who was very much specialized in epilepsy, because his seizures were certainly very complicated and sounds very refractory, right?
Yes. So now, my brother, he was born with it. Are there other instances or experiences that could cause someone to develop epilepsy later on in life? Could an injury cause someone to develop seizures?
Yes, absolutely. So I think it's very important to convey to patients or just the public in general that anyone can have a seizure at any point in his or her life, right? There's never a period of time in our lives when it's completely zero, right? That there's no chance. So when you look at the way the chances of having epilepsy like distributed during our lifetime, you have a peak in children. It's almost like a U-shaped kind of curve. So you have a peak in children, and then it kind of goes down and it starts rising, and then it continues to increase, especially after the age of 65. Obviously, somebody who's a child, those seizures that tend to occur because genetic abnormalities, maybe birth trauma, maybe very obvious brain malformations. And as we get older, right, as you mentioned, you may play football, you sustain head trauma, you might have had a car accident, you sustain a head trauma, absolutely. People have strokes, and they may go on to develop epilepsy. Certain neurodegenerative conditions like Alzheimer's dementia, for example, carries a certain risk of epilepsy. And so yeah, certainly risk factors for epilepsy will change throughout our lifetime. Yes.
Okay. When my brother used to have his grand mal seizures, and we would have to call 911. We didn't do it all the time, but we would have to call 911. And when the paramedics would come, 9 times out of 10, they would say to me, "Is he on drugs?" That would hurt my heart. And I never really understood it. I'm 3 years younger than he is. So in my mind, I'm saying, is he on drugs? He's epileptic. He just had a seizure.
Right.
But then I found out later on in life, when I started doing research on epilepsy, some illegal drugs can bring on seizures.
Yes, I mean, absolutely. And I think it's very important to rule out those substances because if you for example, so some of the substances would be, for example, like cocaine or amphetamines, something on the street that is called K2, um, PCP, right? So those are some of the street drugs that can certainly bring on seizures, but doesn't mean that those people are in fact epileptic, right? They'll take K2. I see that a lot, especially with K2, and then they will have seizures, and then only to wake up the next day and leave the hospital. Doesn't mean they need to be on seizure medications. Just please, I usually ask them, please nicely stop doing K2, like for your own benefit. So absolutely. And I think the reason why paramedics ask that because, um, you know, seizures that are related to substances kind of tend to stop, right? You don't have to be as aggressive at treating them. But like somebody like your brother, where if you don't treat first seizure, a second may happen, and a third. Next thing you know, you just kind of like it's a runaway train, and you're trying to stop it. So I always tell my patients that they have a bracelet that says that they have epilepsy, or some sort of identifying, like a jewelry piece of jewelry on them that says that they have epilepsy. Otherwise, people will assume that they in fact are high on something, or maybe withdrawing from something, and will get mistreated, right? Some people, when they have convulsions, may be very aggressive afterwards, right? Because they have no memories, and you can imagine how people respond when you're punching policemen, right? Certainly have had patients end up in jail because they had seizures, but because they had no recollection as to what happened. So I always ask them to wear some sort of identifying, like I said, jewelry or something that clearly says that they're who they are and that they have epilepsy, so they can actually get help that they need.
Yeah, yeah, that does make sense. Now, is all seizures, and I know they're different types, can all of them be controlled by medicine? Or are there some people who have seizures and medicine is not working for them?
Right. I mean, great question. Unfortunately, despite many years of developments with medications, about 30% of patients with epilepsy are still going to be refractory to medications. And what does that mean? It means that the person tried and failed, or didn't respond, or maybe developed side effects to two or more just seizure medications. And unfortunately, about 30% of patients, which means if you have out of 10 newly diagnosed patients with epilepsy, 3 out of those 10 will be refractory. And then you have to start getting creative as to what to do next, because we know that you know, a common misconception also is like, well, I'm just going to add another medicine. I'm going to add another medicine. I'm going to switch medicine. And unfortunately, we know that if you start just simply adding medicines, often you end up with like many side effects, which most people can't tolerate. They won't take their medicines. And then the side effects end up being worse than seizures. Or just keep switching. But we know that if somebody tried 3 or so medications, the chances of that the fourth or the fifth or the sixth are gonna work is like maybe 5% at most. And I think it's very important to convey that like, well, you tried 3 medicines at good doses, you still have your seizures at high frequency, you can't drive, you can't work. So we
Right.
need to think about what other avenues do we have to try to control your epilepsy, right? And we do have, it's not for everybody, we do have some other options for those 30% of patients who are refractory.
Okay. So, as you know, medication can be very, very expensive. So, for someone who's epileptic, they have to take their medicine every single day.
Right.
My brother, one of the medications that my brother does take is Depakote.
Okay.
And I know that is a very expensive medication. And
Mm-hmm.
he can't take the generic of the Depakote. So explain to me why some epileptic patients can't take a generic brand of like Depakote.
Mm-hmm. Okay, right. So I mean, generally, right. So some medications, older medications, are going to be generic. And then when you try those medicines, you almost inevitably going to try generic because it's cheaper for the insurance company. And there are still medicines that are still brand and they're going to stay on brand. Some just came out maybe a year or two ago. Others will maybe come off patent in a year or two. So those are brand medication. There's nothing you can do. There's no generic substitute. The medications that are brand, they're quite expensive. They usually probably cost about without insurance, probably would cost about $1,000 or so a month. Interestingly enough,
Yeah.
it's not. It sounds like a lot of money, but compared to some other medicines that my colleagues use for other conditions like multiple sclerosis, for example, this is actually quite low. I know it sounds as terrible as it sounds, but certainly I always tell my patients I wouldn't be able to afford $1,000 worth of medicine each month. So, but we have patients when they, for example, patients come off, the medicine is no longer brand and now it's generic, so the insurance wants the patient to use a generic medication, and they may try, but then generic medications are not equal brand because the amount of active medicines and generic medication varies from the brand, and that's okay. FDA allows that, and it's actually could be a quite wide range in variability. So you can imagine somebody who's perfectly controlled on brand name. You switch to the seemingly same medicine, it's generic, and they come with their toxicity, meaning like they come with side effects. They never had side effects. Well, why is it? Well, because actually there's more active substance in the generic that they're taking compared to brand, or vice versa. They haven't had a seizure in 3 years, and now they come with a breakthrough seizure, right? And why is that? Because there's actually less active substance. So in patients like that, you can request the insurance company to authorize the brand name medicine, and they will pay for it as long as it's authorized. Some people also develop just maybe like a rashes or something like that on generic medication. So maybe your brother was one of them where they tried switching and he either developed side effects or lost seizure control. And then, you don't play around with seizures. So maybe if it happens once, you're like, that's it. You're going on brand. I know it's going to be the same brand and forever and ever as long as the insurance is willing to pay. But it's significantly more expensive brand than generic,
It is.
absolutely.
It is.
Yeah.
Yeah, very, very expensive. So does proper rest and trying to control stress, which we know we deal with stress every day
Right.
in our life, does that play an important role as well as taking your medication every day? Does that play an important role in minimizing someone having a seizure?
I mean, we certainly know that, when you ask a group of patients, like what brings on your seizures, they often will say stress brings on my seizures, right? So we do know that stress certainly will play a role in breakthrough seizures in some patients. Some types of epilepsy, for example, epilepsies are very sensitive to lack of sleep. So I always tell patients to you absolutely have to make sure you sleep. It, it, it comes into play often when somebody goes to college, right? Or maybe somebody who has a new child, like a newborn, right? Those are the two instances in our lives when lack of sleep becomes kind of more profound compared to when we're children or when we're just kind of like adults with no small children. So yeah, you talk about that. You also talk to people about alcohol, right? And then medications potentially interacting with alcohol. Whether or not it's okay to mix the two, right? And it depends on the provider, how they feel, and it depends on what medicines obviously they're taking, because some medicines will make you sleepier than others. So yeah.
Okay. So tell me, what word or words of advice would you have for that individual who is living with epilepsy for years? My brother was so embarrassed to even admit that he had epilepsy, or even if he had a seizure, you could just see it on his face that he was so embarrassed. And we would tell him, my family, that this is something that you were born with. It's nothing to be embarrassed about. Do you see that a lot with your patients? And again, what words of encouragement would you have for someone who is epileptic?
I mean, absolutely. I mean, right? So seizures, when you have a seizure, it's often loss of control, right? It may be control of what you do, how you act. It may be you may pee on yourself, right? I had patients who would like undress themselves. Or like go to their neighbors in the middle of the night, and that was part of their seizures. I mean, I think unfortunately, there's still a lot of stigma attached to epilepsy. Um, and just an example would be somebody who maybe is diabetic or has heart disease, right? And they may get dizzy, but nobody's gonna like think it's a big deal. They'll be like, it's okay, just drink some sugar or drink some juice. Um, and I don't know. I don't take care of diabetic patients, but I suspect they're not nearly as embarrassed by their conditions as those who have epilepsy. And unfortunately, they have no control over it. It's from
Right.
like what 99% of the time. Um, I think education of patients, but also I think we have to kind of educate the public that it's just a condition. It's very common. I always say that it's very common. It's about over 1% of the population is walking around and is epileptic. So it's actually quite a lot of people. So I say, like, if you have a massive family reunion, somebody's going to be epileptic, right? Somebody's going to have epilepsy, and having just this isolated seizure is very common. 1 in 10 will have a seizure in their lifetime for whatever reason. I usually just say, I'm here for you. Like, we'll make it work. I mean, I tell my patients that my job is to make them as seizure free as they are as we able, because medication side effects, as I mentioned earlier, are terrible as well. So you're trying to reach this nice balance of seizure freedom or seizure control versus side effects of medications. And then, again, my goal is to give them as like fulfilled and independent life as possible, right? Because unfortunately, many of them, um, they can't drive, right? They can't keep a job. They can't even sometimes hold their newborn child, right? Because they may have a seizure at any moment, and then so they can't even enjoy that. So it's and yeah, people embarrassment comes a lot, yeah, unfortunately. But,
So do you know of any resource groups that people can attend who
mhm.
are epileptic? Because I can imagine that peer support would be awesome.
Right. So certainly, so there is oh my goodness, now I'm blocking on the name, of course. Um, Eastern Pennsylvania Epilepsy Association, right? I think, yeah, like Eastern, yeah, I think that's the name. I'm just like, it's a combination name that eludes me every time. I know they are a very strong resource. They are awesome resource because they do have groups. They meet at least once a month with various providers, epilepsy providers throughout, in the area, and they discuss topics such as, as you mentioned, like epilepsy surgery versus side effects versus pregnancy. Patients also have care providers, and care providers also need education and support. So they also can meet. I think that's probably the best resource. There are also Facebook books. Not that I'm advertising those. I'm actually a part of one. I joined. I don't chime in very often in those groups, but I join just so kind of understand what my patients may be going through. Like, I think it just kind of gives me a different perspective as to how confusing the condition can be. I certainly learn a lot from those, from just reading through the posts of like certain Facebook pages, there's one which is massive. I can't remember, but it's like international, and I think people certainly get a lot of support and answers, and they can just vent on the group on that group Facebook page, and that's very nice too. Yeah.
Well, thank you so much. Thank you so much for taking the time to explain everything to us regarding epilepsy. I truly appreciate you, and thank you for joining me today. Thank you for joining me today. This is a very special show for me. My middle brother, Eric P., is epileptic. It was something that he was embarrassed about for years, but he has now come to realize and understand what is going on with him being epileptic, and he is no longer embarrassed. So please take care of yourself if you are epileptic and follow your doctor's instructions. Thank you for joining me today. Peace and blessings.